one other point that I would make is that for all of the issues that are very contentious right now, and there is some real, honest, genuine, legitimate dispute about where we should go on some of those issues, there is also a great deal of agreement in Washington about a lot of things that need to be done, particularly in the area of delivery system reform. We have, I'm getting way too loud here. We have, depending on who you listen to, George Bush's Treasury Secretary says there's $1 trillion a year in waste in the system. The Lewin Group, which is a consulting group in Washington that is viewed as one of the experts on healthcare, say there's $1 trillion a year in waste in the system. The President's Council on Economic Advisors says there's $700 billion a year in waste in the system. And there's a lot of agreement about why it exists and what can be done to alleviate it. It includes everybody having access to an electronic health record so that your paper file doesn't have to follow you when you are rushed to the hospital or rushed up to Boston. I've had people come to my office who nearly died because their paper file didn't go in the ambulance with them up to Boston when they needed a particular emergency procedure that they had to do up there. That's just silly in a world in which Amazon exists and you can log in right away. And I think probably a lot of people in this room have had the experience of sitting there at that clipboard in the office, filling in for the umpteenth time all the conditions that you've had, your identifying information, your insurance information. And once they know who you are, there's really no need for that. Quality improvement can step up a lot. Oh, I think I just lost my sound now. I'll just keep talking and I'll let the microphone people try to solve this. Quality improvement can improve a great deal. We're doing some wonderful stuff in Rhode Island right now in our intensive care units, getting rid of hospital-acquired infections and line infections and things like that. Rhode Island is a real leader there. At present, we kill about 100,000 people a year from avoidable medical errors. So there's a big quality improvement that will save money because you're not spending those extra days in the intensive care unit treating the infection. You're actually out when you should be. Prevention. The Diabetes Coalition of Rhode Island was in to see me today. Prevention, we underinvest in. We do it for a lot of reasons that are good economic reasons, but bad for humans, bad for America. And that is something that we can get a lot better. And finally, we can get a lot better about the transparency of the healthcare system. So you have a better sense of what works and what doesn't, what's worth the money and what isn't. And that doctors, particularly these young doctors here, when they come up with this, don't get paid piecework. They get paid for outcomes. And they get paid for the results that they achieve. And that will drive the system towards improved results. So there's a lot going on in this healthcare bill. I'm going to take this off entirely if this doesn't stop.
No, we need
oh, then they can't hear in the other room. You're right, okay. I'm not that loud. Okay. So there's a lot going on in this legislation. Much of it is not controversial, but what there is, I'm sure, is what we all hear a lot about tonight. So that's why I want to focus in the early part, before we get into the controversial part, about a lot that isn't. But as George said when he set this up, Nick, who is here, has a microphone. Tony, who is here, has a microphone. And we're going to do 2 questions from this room, and then 1 from the other room, which we'll just have to audio in, and then 2 from this room, and then 1 from that room, so that you guys got here first. You got favorite status. You get 2 for 1. So we'll start.
You might get a chance.
Everybody gets a chance. Sir. I try to stay afterwards as long as I can, so if you don't get your question answered in the live session, feel free to stick around.
The other point is you all have on your tables sheets to write questions. We will respond to all questions. So, if you have a question, please put it down on paper, hand it in tonight, and we will respond very soon.
Sir, you can leave them at the door, or leave them on the table and they'll pick them up. That will be taken care of.
My name is Roger Soule. I'm a veteran and a disabled artist. Since the founding of the Plymouth Colony, my family has helped to build and protect this land. While it doesn't make my views any more valuable than the next person's, they at least deserve to be heard. In 2005, I was diagnosed with Huntington's disease. It is degenerative and incurable. 30,000 people in the U.S. have diagnosed with it. It does not skip a generation, and it will manifest if a mutation is present for it. Hundreds of people have gone through what I did after this diagnosis. The disability division of Social Security didn't have the proper medical information. The HD and were deciding cases quite arbitrarily. Many other cases, as was mine, were initially denied. I had no income, so I had to take up a bed in a homeless shelter that could have been used for someone who needed it. My second, make a long story short, after a year and a half, I had that effect on kids.
Not your question, I promise.
I'm not that bad. My main point is that right now in the House, there is Resolution 678 is the Huntington's parity bill. It's in committee. It just requires that people that are diagnosed with Huntington's be automatically granted disability status without having to wait the 24 months and not having to go through all the appeals that many other people had. As far as health care, I'd like you to, when that gets to the Senate, I'd like you to please support that resolution. Also, I urge you to push hard for a public option in health care. People are uninsured or just hanging on. My neurologist told me I was falling in an insurance black hole. The instant my diagnosis was complete. People with pre-existing conditions could lose their health care once they get diagnosed with anything, as this lady did with their MS. Thank you very much for listening.
I'll certainly take a look at the Huntington's parity bill. I will look to see if it has sponsors in the Senate at this point and see what we can do. I am sympathetic to the situation of that initial delay once you're diagnosed with something that people know is going to end up with a disability. The delay period doesn't make a lot of sense. One of the people who introduced me at an earlier community dinner was a lady who'd come into my office, and she had a very serious problem with her heart. And she couldn't afford the heart surgery necessary to fix her because she wasn't on disability yet. And in the time period that she would have had to wait to get onto disability, she probably would have died or been extremely, extremely ill by then. So thankfully, we were able to convince the Social Security Administration to move her in quickly because they'd have that case sooner or later, and it only makes sense to do that with an illness like yours. So I appreciate you bringing it to my attention. And Jack and I both worked very hard on the public option in the health bill in the Senate, and we are both supporters of the model that we have passed out of the Health Committee.